I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Hey folks, Dr. Joe here. Hope everybody's having a wonderful day. I'm certainly having a wonderful day. And as always, I love spending time with you guys because we give you information that you need to naturally get well and stay well. And for years, I've been on the radio, and for 33 years, I've been in practice. And there's always new stuff coming out. You're never totally caught up. But that's okay because gives me something to talk about on the radio. But the bottom line is there are certain rules you need to follow in order to get well and stay well. And so what I'm going to cover today are a couple of things that are in the news, a couple of news items that I think are important for you to understand, because sometimes when a news item comes out, we read it and we say, okay, I read that on the news, I saw it on my homepage, whatever, so it must be true. And then you alter your life around that information when it may not necessarily be correct. That's a big thing, because a lot of times people come in and say, well, Dr. Joe, I read that. You need to drink whatever. And I'll say, well, maybe not. You know, a big thing, a big buzz a while ago is alkaline water. And people are saying, well, alkaline water, it cures cancer and it puts hair on your chest and it does all these wonderful things. And my point was that I'm not against the alkaline water. But my question I have for my patients then is, why do you need alkaline water? Well, it alkalizes my body. Well, then why is your body so acidic? Well, I don't know. I never thought about that before. So I want you to think about getting to the cause of your problems, not just treating the symptoms. So if you're eating a diet that consists of alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, your standard American diet, the chances are that your body's going to be very acidic. When the body's acidic, it doesn't function very well. But when we alkalize the system, make it less acid, more alkaline, the cells work at a more effective level. And that's why people say, well, gosh, I drank alkaline water and I felt great. Well, that's true. However, if you didn't put all the bad stuff in your body to begin with, you probably wouldn't need the alkaline water. So again, I'm not against you drinking it, but if you put too much alkalinity into your body, you go into a state of what's called alkalosis. And that's dangerous too. You could be in acidosis, too much acid, or too much alkaline. You got to be careful. So you don't want to mess with this stuff. And I saw a commercial the other day, and it was for raising your HGH levels, human growth hormone. And it increases it an amazing amount, and it's wonderful. And as you get older, your HGH levels drop, and you can boost your HGH levels. Well, that's a good idea. I'm not against that. However, too much HGH can increase your risk of disease, like cancer, for example. So now there was a commercial a long time ago, it's not nice to fool Mother Nature. And that's exactly what you're doing. You're messing with Mother Nature. Now, if you fix your body and keep it healthy, that's different than treating the symptoms that the body's coming out with. So that's what we're going to talk about today, are news topics that you might have bought into, so to speak, that might have been a bad choice on your part. So let's talk about the diets, because big one is diet. Of course, and people come out, and every year they come out with the diet of the year, and this is going to be the best thing in the world. So a while ago, they came out with the diets of the year, and the Mediterranean diet was ranked number one overall with U.S. World and Health Report, and it should be pretty easy to stick to. Now, I'm agreeing with this. I like this report. I'll give you the howevers in a second. Mediterranean diet, it's a lot of vegetables, nuts, whole grains, fish, olive oil, poultry, eggs, cheese, yogurt. Sounds pretty easy. Now, you might have to skip the processed foods, and you want to keep beef to a minimum. But generally speaking, you're looking at the Mediterranean diet. So if you read that topic, you would say, gosh, I could eat all the fish and olive oil and poultry and eggs and cheese and yogurt that I want, along with veggies and nuts and whole grains, and I'm going to be living the Mediterranean lifestyle. Aha, whoopee! Well, okay, let's dig a little deeper. The flexitarian diet, just so you know, what was ranked later, number 3. I don't know what number 2 in this study. That's more plant-based meals in your diet with a little bit of meat and dairy products. That took number 3 overall spot. And Weight Watchers took number 4. And this was according to an analysis of 40 different diets that U.S. News and World Report did. Okay, so far, I'm okay with everything. So far, so good. Well, here's the kick. If you truly live a Mediterranean diet, you're not going to eat a lot of fish and poultry and eggs and cheese and yogurt. You're going to eat mostly fruits, vegetables, nuts, and seeds, which is what I've been telling you to do for what, 30, 40 years now. So that's a good thing. Also, if you go to the Mediterranean, the fish that they eat are fresh caught out of clean water. It's not the farm-raised fish that most of you are eating on a daily basis if you live in the United States. And the farm-raised fish many times are fed steroids and hormones and chemicals and pesticides. They're fed soybeans, corn, sometimes chicken poop. Now, in nature, a fish wouldn't eat corn or soy, or genetically modified corn or soy especially, and it wouldn't eat chicken poop. It would eat natural foods that are part of the normal ecosystem in clean water. So if you're going to follow this Mediterranean diet, you got to really do it the way the Mediterranean people do it. Pure fish, fresh fish. By the way, they catch it and eat it sometimes within an hour or two. When was the last time you had fresh fish if you live in the interior of the United States? That was seafood. You have to go out and catch it. You have to freeze it. You have to process it. You have to bring it to the plant. So there's a difference between what they're eating and what you're eating. The poultry, they're not fed genetically modified corn and soy in Europe. A lot of parts of Europe anyway. And many times if you're using genetically modified food, it's sprayed with things like glyphosate, which is a weed killer. That's why we genetically modify it, so we can spray weed killer on it, so that we can kill the weeds but not kill the corn or the soy. Well, when you genetically modify anything, you change the DNA. You change the molecular structure of that plant or that animal. Gosh, we're doing it to animals now, like salmon, for example. So it's genetically different. And the argument is, no, it's exactly the same. It's exactly the same. Why are we doing it? You know, the argument is kind of like silly. It can't be exactly the same, or else we wouldn't have to create it to spray the weed killer on it to kill the weeds, but not kill the plant. The plant has to be resistant to the weed killer, so it's not the same as non-genetically modified, let's say corn or soybeans. Yogurt, same thing. The cows are fed grass. They're not fed corn and soy, which cows are not genetically designed to eat, or biologically, I guess I should say, designed to eat. And the cows that eat grass have higher omega-3 fatty acid and lower omega-6 fatty acids. When you start farm raising these cows, or factory farm raising these cows, they're fed corn, soy. The omega-6 levels go up, which increases your inflammation. The yogurt and the cheese that they're eating are not pasteurized. Here in the United States, you have to pasteurize it. Not against the pasteurization process. It kills viruses, germs, and bacteria. But it also kills the enzymes that are in the plant, that are in the yogurt, that are in the cheese. And so that's why if you took pasteurized milk and fed it to a baby cow, that cow would die in about, I think it was 4 weeks was the last study I read. Because you kill the enzymes from the mother's milk and the cow can't survive. So looking at the Mediterranean diet, we're talking about things that are in the news that you got to really dig a little deeper to get the true story on. If you're going to follow the Mediterranean diet, which was chosen the #1 diet by U.S. News and World Report, you have to make sure you're doing it like the Mediterraneans do. You have to eat fresh caught fish. The grains can't be genetically modified. The nuts and the vegetables can't be sprayed with pesticides and chemicals. Essentially organic. Olive oil, essentially organic in most cases. The poultry, eggs, cheese, and yogurt have to be at least organic. So if you're going to do this, I recommend you, if you're going to eat any animal products, always, they need to be organic only or don't eat them. Just that simple. It's not hard. Organic only or don't eat them. I choose not to eat them. I haven't had an animal product in over 32 years now, 31, 32 years. And that's okay. It's my choice. What you choose is up to you. I can give you information, and what you do with it is up to you. You have the free will to choose. But if I can logically hit you with facts, sometimes it's hard to argue like, yeah, you're right. And that's what a lot of people do. Yeah, you're right. And then they give in and they do it the way I say, and they're very happy with their choice. I would prefer you just go with the fruits, vegetables, nuts, and seeds. Stay away from the meats and the dairies and the yogurts and the cheeses. And then you're doing how about this, a modified Mediterranean diet. I just made a word up. Modified Mediterranean diet, and that keeps you healthy. Now, why am I so hell-bent on you being healthy? Well, I'm a chiropractor. I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition, BS in nutrition, a retired dietitian, award-winning author. This show that you're hearing is heard coast to coast and around the world. And I've been in practice over 33 years. So if you come to us as a patient, we can be giving you the best chiropractic care possible. My team of doctors, all of them are my personal doctors, so I love all my doctors. But we need you to help us if your goal is to get well and stay well as quickly as possible for the least amount of money. And so that's why I push so hard on the nutrition. And some people just want to talk about nutrition with me, and that's fine. I'm more than willing to talk to you just about nutrition. But I then tell you, listen, if you have pinched nerves, if you have a malfunctioning digestive system, you need to get those fixed as well. But if you just want to talk about nutrition, I'm not going to argue with you. If that's what you want, more power to you. And so what happens then is people will come into our office, I just want to talk about nutrition. And then I'll check their spines and I'll check their digestive system. And they'll say, wow, I didn't realize I had pinched nerves, because 90% of your nerves don't feel pain. So you can have a pinched nerve and not know it. I didn't realize that nerve that in my neck that's causing my neck pain also goes to my heart and lungs and is affecting my breathing. Well, yeah, it is. And most people then say, you know what, Dr. Joe, let's just do this right. Let's get it over with and let's do it all together. Some people just want nutrition. I'm fine with that. Some people don't live close enough to our offices. And so then we can just do nutrition then as well. But the goal is to have a normally functioning nervous system, a normally functioning digestive system, and good nutrition. And if you're reading the headlines and you just see something, oh my gosh, it must be good because it's in the news, that may not necessarily be true. And usually it's not. You have to dig a little deeper. That's called investigative reporting. Ooh, oh, look at that. I'm an investigative reporter. I didn't even think about that. So we want to get to the cause of the problem, not just treat the symptoms. Eating a diet of fruits, vegetables, nuts, and seeds, absolutely great. Flexitarian is vegetarian with a little bit of meat here and there. If you're going to do it, organic only. Now, this is a new trend that's in the news, and I kind of laughed at this. Raw water. You got a kick out of this. It's a new health craze. A lot of people are paying outrageously high prices for unfiltered water, which is reportedly putting those Americans at risk for diseases like hepatitis and the norovirus. And this one, I agree with. According to a report in the New York Times, demand for raw water in and around California's Silicon Valley has sent prices skyrocketing. Small companies bottling their untreated product have hiked the price from $36.99 to over $60 for a 2.5-gallon jug. And they say it has a vaguely mild sweetness, a nice smooth mouth flavor, nothing that overwhelms the flavor profile. So now we're talking about water like we talk about wine, I guess. So raw water is essentially water that comes straight from natural sources and is not passed through any government cleaning processes or pipes. Okay, so far so good. I like the fact that it doesn't contain fluoride, which is usually added to tap water, and they say it prevents tooth decay. But the problem is this. When it comes to fluoride, fluoride works, I'm not going to argue this point, although I may not agree with it. It's supposed to work when you put it on your teeth to prevent cavities. All right, I'll give you that. Let's assume that's true. However, when you're drinking tap water, are you swishing around in your mouth, putting on your teeth and spitting it out? No, you're drinking it, you're eating it, you're mixing it with your foods. So when fluoride gets into your body, it becomes a poison. So now we have a problem. We're putting it into tap water to help teeth, but it's not getting on your teeth, it's getting in your body. And when it gets into your body, it can do several things. Number one, it can affect your thyroid gland. See, there's something called haloids. It's a group of chemicals called haloids. Bromine, chlorine, fluorine, and iodine. And they all look very similar. And when you put iodine in your body, the main organ that sucks it up, although all the organs need iodine, is your thyroid. And the thyroid sucks up the iodine and it uses it to create thyroid hormones. And that sounds like a good idea, and it is. However, when you put fluoride or chlorine or bromine into your body, it can block up the iodine receptor sites. So you're not absorbing iodine properly. So your thyroid gland may now be challenged. Because most of us, A, have too much haloids in our body, too many haloids in our body. And B, we don't get enough iodine. So the thyroid's looking around for something to make hormones with, and it says, ooh, you look close. Come on over here. Thyroid gland isn't picky. And it says, I could use, with fluoride, you look like iodine, come here. And it sucks it up. Well, it's not what you need to make the good, healthy hormones from the thyroid gland. And so that can be a problem. So if you're drinking unfluorinated water, I like that idea. I have a water filter in my house. It's about 5 feet tall, and it filters every drop of water in my house. Takes out the fluorine and the chlorine and the chemicals. And it's expensive, but I'm worth it. And this is the thing, too. When you get healthy, you're going to save so much money that you can afford these crazy, extravagant things like, I don't know, a water filter or vacations or quality health care. So this is the cool part, is when you're healthy, it's cheaper to be healthy than it is to be sick. And the food you're going to eat is so much cheaper. Most people report that when they start doing my recommendations, their food bills drop in half. It's pretty nifty, huh? Imagine if your food bills would drop in half. Housing is number one when it comes to most people's expenses, and food is number two. Drop that in half, you can get a nicer house. You can get that new couch you wanted. You can get that new car you wanted. You can take out that special person who you wanted to be with and didn't know what to do because you didn't know how to impress them. Hey, man, let's go out for a hike. Let's go kayaking. Oh, interesting. Anybody can take somebody out to dinner. You know, as a guy, I know this. I can ask a girl out to dinner. I've been out to dinner 1,000 times. Hey, how about we go kayaking? Ooh, that sounds like fun. How about we go hiking? How about we do something different? And when you have health, you're able to do these things that make life a lot more fun, and you'll probably have the money to do it. So anyway, I'm not happy with this raw water because it can cause problems. Get yourself a good filter. I have some water filters on my website, drjoeesposito.com. You can look under the store part. We have water filters there that go under your sink, and those are good. And at least have one for your sink. If you can afford it, go all the way out and get it for the house. But you're talking $5,000, depending on the kind of water filter you want to get. You know what? It's worth it, though. Now, folks, again, I said my team of doctors and I are chiropractors. If you'd like to make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge. We would love the opportunity for you to come see us, because most people come to us and say, Dr. Joe, I'm sick and tired of being sick and tired. I'm ready to get well. And I'll do what your team of doctors say. And when they do, almost inevitably, they're thrilled. But this is the key. You got to do what we say. You can't do a little bit of it. Well, you can if you want. You're going to get some benefits. But when people go all in, usually about 60 days, I like to tell my patients, I want to own you for 60 days. They're extremely happy with the results in most cases. So if you have neck pain, back pain, shoulder pain, numbness, tingling, you've ever been in a car accident, if the car was damaged, you were damaged 100% of the time. So if you're ready to get well, go to my website, drjoeesposito.com, or just Google Dr. Joe, number one Dr. Joe in the world, and we will set you up a time to come see us. We take patients with all insurances, no insurances, car accidents, sports injuries, workers' comp. A lot of workers' comp companies send us their patients because they realize that chiropractic care, in most cases for back injuries, is the least expensive with the fastest healing time. So why wouldn't you do something that's the least expensive with the fastest healing time with the least amount of side effects? To me, it's a no-brainer, and that's what a lot of insurance companies get now, too. So if you're ready, for you, your family, and your friends, drjoeesposito.com, or just Google Dr. Joe. We'll set you up a time for our offices in Marietta, Duluth, and Stockbridge. So we're talking today about things that are in the news and how sometimes you read the headline and you go, wow, that looks like a pretty good story. I'm going to read it. Like the Mediterranean diet is the number one diet in the country. Well, that's true, but it's not the way the Mediterraneans eat our version, because of the steroids and the hormones and the chemicals and the pesticides and genetically modified foods and the fishes and fresh caught out of the sea. And the fruits and vegetables usually have to be shipped from somewhere. They grow it right there in most cases. The cheeses and the yogurts are not pasteurized, so they have enzymes in it. Once you pasteurize, you kill the enzymes. So there's a big difference between just saying, I'm going to eat like a Mediterranean person, or actually eating like them. And then the raw water, this was funny because it's just unfiltered water, which I think is great if you could find a truly pure source of water. But I'm thinking in California, you're probably not going to find a truly pure source of water. So get yourself a good water filter, filter it out, and then you've got pure water. And again, a couple of bucks, but it's worth it because you're going to save so much money when you have a normally functioning nervous system, a normally functioning digestive system, and good nutrition. That's the key. That's the trend in healthcare. You want to know what the trend is? I'm telling you right now. I've been doing this for 33 years. I see patients every day. I still practice full time. And my team of doctors, we all practice full time. So we see it every day. We know what's going on, and people are just tired of taking medications when there's an alternative. I'm not saying don't take the medication. I'm saying don't take it if there's an alternative. And many times you don't know the alternative, and doctors don't know the alternative, medical doctors, because that's not their field. I have patients come in, we have them all the time. You know what? I saw one the other day. It looked like a fracture in her neck after a car accident. We need to get you an MRI right away. Sent her out for an MRI. We were wrong. It wasn't a fracture. Yay! Week before, we had a workers' comp case come in. Thought I saw a fracture, sent her out for an MRI. Guess what? We were right. Hospital missed it. Luckily, we caught it, sent her out to an orthopedic surgeon, stabilized the neck. Now she's good to go. So I'm not against drugs. I'm not against surgery. I sent her to a neurosurgeon, actually, not an orthopedic surgeon. I'm sorry. I sent her to a neurosurgeon who did spinal work on her and fused it, and she was good. No, he didn't really fuse it. He just worked on it, made sure it stabilized it. So we like to work with other doctors, and other doctors like to work with us because we try to get to the cause of your healthcare problem and not just treat the symptoms. Now, I'm going to run out of time for this segment. Let me cover something else here. Okay, this is a fun one. Cover this guy a few minutes, and then I'll cover. I got more to cover. I got a lot more to cover here. So this is interesting. Woman went to a hospital. She thought she had Crohn's disease. She had inflammation in the bowels. It hurt. They did studies on her, and a woman's health scare was the first cause was caused by a synthetic plastic packaging that mimics the symptoms of Crohn's disease. So what she did is she ate a ketchup packet. Somehow got in her food. The plastic synthetic packet got into her bowel and was digging into the bowel, causing inflammation. And with this inflammation, the doctors kept diagnosing her as Crohn's disease. Well, I could see where that would happen. I can't argue with the doctor here that if it looked like Crohn's disease, for 6 years, that was the problem. And when they went in there and did a CAT scan on her, they found that there was something in there, and it was a sauce packet. That's what I won't say the brand name of the company, but you know the brand name of the company. So here the doctors, and the reason I'm spinning this, is doctors finally got to the cause of her problem instead of just treating the symptoms. So sometimes we fall short if we don't do enough testing. And what I don't like is that insurance companies lately are saying you can't have that test, it's not necessary. Who decides that? Who at the insurance company can say, you need more care, you need less care? Have you ever seen the patient? No. Have you ever met the patient? No. Well, according to our standards, this person, we're not going to allow this testing on. Now, had they done a test on this woman, a 41-year-old woman with abdominal pain and bloating, had they been able to do the test, and again, I don't know if they were able to do the test or not, this was in Britain, we would have found the problem. Now, I understand the insurance companies have to watch their bottom line and they have to make a profit, and I totally get that. But I remember when Obama came out and he said the new insurance laws are going to be this. 80% of what an insurance company collects has to go to pay claims. They can only keep 20%. Now, I don't have the stats on this, so I have to plead ignorant on this one. But I tell you what, in practice, my colleagues and I, my doctor friends and I, medical, chiropractic, neurosurgeon, orthopedic surgeon, psychiatrist, we ain't getting paid more. We're getting paid substantially less. You are paying more out of pocket, and your premiums have skyrocketed. And I can't find the stats on this. If any of you know this, send it to me. Are the insurance companies truly paying out 80% of what they're supposed to? And if they are, I don't know where it's going. It ain't coming to the doctors, and it ain't coming to the patients. So I'm kind of curious as to where it's going. And I see this, and also when the new insurance laws came out a while ago, they was everyone's going to be treated equally. No matter what profession you're in, if you do this service, you're going to get paid this amount of money. Well, that's not true. I have a friend of mine who's a neurosurgeon, and he did a brain tumor. I think it was a brain tumor. He had to remove a piece of the brain out, and there was some bleeding in there. And it was normally a $70,000 operation overall, hospital, everybody. The insurance company paid $1,200 on a $70,000 operation. Doctor said, that didn't even cover my malpractice for that day, the part that he got. So I don't know where all the money's going, but the reason I'm going into this rant is this. I want you to be as healthy as you possibly can so that you can reduce your need for things like surgery. I'm not against the surgery, but if we can keep you healthier, that'll free up the doctors to do surgery on people that didn't either take care of themselves or did take care of themselves and it went beyond something that was manageable. And now we need to go to something more aggressive, like surgery. And I'm assuming most of you would like to be healthier, not less healthy, but more healthy. And so we do that by three things. If you have a normally functioning nervous system, a normally functioning digestive system, and good nutrition, that's what you want to do. So folks, if you want to come see us, we have offices in Marietta, Duluth, and Stockbridge. We accept people with all insurances, no insurances, cash patients, car accidents, sports injuries. We would love the opportunity to be your doctor. So if you're sick and tired of being sick and tired, if you're ready to get well, go to my website right now. You can make an appointment, drjoeesposito.com, or just Google Dr. Joe, number one Dr. Joe in the world, and we'll set you up a time to come see us. Because our goal is to help you naturally get well and stay well. Again, a website, drjoeesposito.com, or just Google Dr. Joe. Hey, folks, thanks for listening to the show. Thanks for telling your friends about the show. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.